There's, oh, yeah. Hey.
Hey, how you doing?
All right. How are you? So you
Good,
got
good, good.
on Evolve and you got Saunders. You're all set to go, right?
Yes, ma'am. Yes, ma'am.
Good. Yay.
Yes, I'm excited to do more work.
It'll be worth it. It'll be worth it in the end, though.
Yes, yes,
Um,
yes.
Hi. How are you, my dear?
I'm good. How are you?
I'm good. I'm glad to see you today.
Nice to see you too.
Yeah. All right. So, and then there's Clarincia. Clarincia. I hope I said it right. Oh, she's connecting. So y'all had a good couple days. So you had med surge yesterday. Or how you doing? How's your
We
week
had
one
clinical.
going? Huh?
It's going, just adjusting, trying to create like a routine to manage everything.
Hmm.
But so far so good. No
Okay.
complaints really.
Okay, good. And the main thing is, I always say, don't procrastinate.
Mm-hmm.
Yeah. Because when you fall behind and you say, oh, it's only maybe a couple days or maybe, oh, this week, don't do that because it's tough.
Mm-hmm.
It's tough to catch up. And then you got all this information in your head. There she is. You got all
Oh,
this.
you were the whole time? I was I was in here for a while waiting for you to come on.
Oh, okay. Well, we're eager. We're eager. Now, what I'm going to do is I'm going to do a little review. I'm
Okay.
going to point out, what things you should be, really holding on to. And then at the end, I did a cahoots. Now, this is the first time I'm doing this cahoots. Okay. So
Okay.
you're my guinea pigs. Because I'm going to see how I can do it. I got the pin number and everything, but it's kind of fun. I thought it was. I took it, and it's kind of cute. I created it.
Yeah, I was trying to do it not too long ago, but it said it wasn't available.
Right, because I have to have a pin, and I have
Oh,
the pin
gotcha.
number. Yeah, but I wanted
Okay.
to see how it would work. Say at in a review. I just want to see how it would work.
Okay.
Otherwise, what I'll do
Okay.
is I'll just give you the link and then give you the pin number and you can go on it and then I can see. And then you can see how much you know.
Mm-hmm.
Okay. So that's something I'm gonna play around with this semester is the cahoots. So I have a lot of reviews on YouTube. So go on YouTube. They're all really good. There's a lot of them because the time goes on, they keep growing. Okay, so anyway, anybody have any concept that they're not sure of? I mean, now this
Okay.
is this
So
is
massaging the fundus, when you massage the fundus,
Mhm.
is that because like when someone's going into labor, you massage the fundus?
No,
Or
massaging the fundus is because her fundus she's delivered the baby. It's during her recovery time, and her uterus is not contracting back to its normal size. Normally, so it's soft, and that means she's bleeding because this uterus is soft. There's a lot of blood coming out of there. So what you do is you're going to massage that fundus, which is the top portion of the uterus, and you're going to massage it until. And you know what? I've had people's uteruses up literally in my hand, even though the uterus is underneath, because I can see it and I can massage it. So look at my hands. So I'm
Mhm.
right-handed. So I get the top of her uterus, okay, and I had a lot of times you have to dig deep because you is so soft. Okay. And then I get so top of the uterus is here, and then I get my other hand on the bottom. So see, literally, I have the uterus in my hands. And so
Okay.
I massage. You see how my hand is sideways. It's not flat. It's on the side. And so I get it's like a cup. And I'm
Mhm.
massaging. I'm going down and that will make that uterus contract and become harder and it becomes firm, I should say, And then her blood, her discharge, her bloody lochia will diminish. That's after she delivers, you massage the fundus, not before.
Okay.
Yeah, you don't want, that's why, going back in history, because I love history, you go back in history, and a lot of women died in childbirth. You know why they died in childbirth? It's because the uterus did not firm up like it should have, and the woman kept bleeding, and she can hemorrhage, and she goes into hypovolemic shock, and then she dies. So now you can really see, yeah. So massaging the uterus, that's called, and that's after she delivers. Okay, Shasha, I know who's
I have a
talking.
question.
Okay,
Hi.
go ahead. Go ahead. Who's got a question?
Okay. I just want to sum it up. I just want to make sure that I'm understanding this in like my way of like retaining information. So I know that fertilization occurs in the fallopian tube, right?
Exactly,
So
fertilization.
for the zygote or whatever, ain't that how you pronounce it? Zygote?
You keep going, you got it.
Okay.
The zygote.
Okay. So with the zygote, that means like the sperm and the ovum, they connect, and then that's when it something about the uterus, like it do its thing in the uterus.
Okay, what happens? Okay, so let me just clarify.
Well, implementation.
Yeah, that's implantation. Yeah, so you know where implementation occurs, that occurs inside the uterus. Okay.
Correct.
Fertilization occurs in the fallopian tube. So when the ovary releases that mature follicle, releases that, okay, and the fembrae then grab onto it, then it becomes an oocyte, okay, and that's released. And when she ovulates, okay, she's at the most fertile. That's when that oocyte is right there, ready to be fertilized. And so when you have these trillion of cells, these sperms to come up, okay, they're finding their way to that oocyte. They go both ways. I mean, they go down the one fallopian, they go down the other one, and they make their way to that oocyte. And one sperm gets in there. Bingo, you got fertilization. That's where it occurs. Now, after the sperm and the oocyte, when they join, then cell division starts, and that becomes then a zygote. And that little zygote then keeps cell dividing all the way to becomes a morella. And then when it becomes a morella, it makes its way into the uterus, okay? And it finds a good spot. Hey, I got to find, and that morella becomes a blastocyst. And then the blastocyst, now this is all cell dividing. And then the blastocyst finds its way into the upper portion of the uterus on the posterior wall. It's a nice, good, safe place for that embryo to start. Okay?
Okay.
All right, so does everybody have that down packed? You know where fertilization occurs. You know you got your zygote, and then you have your cell division. Then it becomes a morella. Then it becomes a blastocyst. It goes into the uterus in the upper portion of the uterus on the posterior wall. You got it. Okay. And meanwhile, the mom, this is all very early in pregnancy when this is occurring. So mom doesn't even really realize that she's even pregnant. Now, around day 7 is when the body starts to produce what we call a hormone called human gonadotrophic So you've got HCG hormone that's being secreted. That's the hormone that can be picked up very early in pregnancy. And that's the hormone that when you do the home pregnancy test, or you go to a clinic and they do the pregnancy test, that's the hormone that's going to present itself. And that's the first hormone of pregnancy. So you need to know HCG, progesterone, and progesterone is needed for what? For
Maintaining pregnancy.
maintain the pregnancy, right? Because progesterone does decrease uterine contractions. So therefore, it'll keep
Mhm,
the
mhm.
uterus quiet, okay, quiet, so that she doesn't have a miscarriage.
Okay.
Now, when some women have problems with pregnancy and they don't have enough progesterone, so the uterus starts to quiver, and it starts very early, and then she aborts the fetus, the baby, the embryo. So that's why when we see recurrent ABs in the clinic, that's why we give a woman progesterone so that she can maintain the pregnancy. So progesterone is another important hormone that you need to know. Okay. And then you have estrogen, right? You have estrogen, and that stimulates the uterine growth. Okay. So just think extra. Like I always think in my head, extra estrogen, okay, makes it more, stimulates the uterine growth. So I hope that helps you remember about estrogen. Okay, and then estrogen will come in handy too when it comes to lactation or breastfeeding, because the breasts need that, because it stimulates the development of the breast ducts. Okay, let's see. So you need to know progesterone, estrogen, very important. And then you have the HPL, the human placental glycogen. And basically, this hormone, and remember, these are the 4 hormones of the placenta, right, that we talked about. So, and then HCG. And HCG, there's always a good question on HCG, okay? There's always a good question on progesterone, okay, always. So does everybody have down what progesterone, estrogen, HPL, HCG is all about?
So HCG, is that the blood test, the very first blood test they do to confirm if a woman is
Well,
pregnant?
actually, they do a urine test. Yeah. It's so easy to do a urine test, you know, and it's not as invasive. Remember, blood tests, when they take out blood, they're actually puncturing your skin, correct?
Yeah.
So that's more of an invasive test. Urine test is not invasive. They give you a little urine in a little cup and sure it up your pee, and then we take it over and we have
Right.
it's and then we put 3 little drops into the little reservoir, and it comes up a positive p like a plus sign, or it has a negative sign. Some have blue and then some have pink, just whoever testing you use. But if you have a presence of HCG in your urine, it's a good sign you're pregnant. Okay. All right. Okay. And then next Monday and Tuesday, we go over like the positive sign of pregnancy, probable and presumptive. That's in chapter 4. So we'll go over that. But yeah, so HCG is your first hormone. Okay. So what I'm going to do is I sent out your PowerPoint and you got them. I'm just going to use that as my basics to go on. Now, this is your time, okay? If you don't understanding anything that I'm presenting or to you, please just raise your hand, I mean, or just say, I don't understand this, okay? I mean, no problem, because this is your time, okay? All right, so let me just see what I got here. I got so much up. All right. All right, let's just do here, because I didn't really go over, let's see here. What happened to my slides?
Can you go over fetal circulation?
I can. I definitely can. Okay. Well, remind me as I go through, okay? You got it.
Yep.
Okay. It's real simple. It's not hard. You have to read it a couple times, but I'll go over that with you because that is tricky. I understand. So again, this is your chapter 2 that I didn't discuss last week, but this is on human reproductive anatomy and physiology. What I want you to see is just the landmarks, because these are things that when we get into labor and birth that you'll hear me talk about, and you'll probably say, what's that? She's talking a different language. No, this is just, you need to know. This is just your basics. So especially, the labia, mons pubis is that fatty pad that lies right over the anterior surface of the symphysis pubis. So when we do like a fundal measurement on a patient, we'll start at the mons pubis, right over the symphysis pubis, and we'll take our measuring tape and we go straight up the linea negra to the top of the uterus, which is your fundus, and get the fundal measurements. So you might hear that, you may see that as you read. The labia majora and the labia minora, these are fatty tissues that basically, you know, they cover and they protect the inner vulvar structures of the woman. And then you got your fourche, which I love. It's just called the obstetric perineum. Okay, and you know the perineum is the thin flat tissue formed by the joining of the labia minora. So another way, because women, you know, we get a lot of infections very easily if you're not very careful with your, you know, like washing after urination or having a bowel movement. Women get a lot of UTIs. And then you have the clitoris, and you have the vaginal vestibule and the perineum, and you'll hear me refer to the perineum quite a bit. So let's just go over this real quick. Okay, so everybody knows the female. And so when I talk about episiotomy, I'm talking about this area in the perineum, okay? And we have to sometimes cut that if the baby if the baby's very big. Now, remember, what pelvis, let me ask you this, what pelvis is the most favorable for vaginal delivery?
Gynecoid.
Gynecoid, absolutely. Good deal. Okay, so with a gynecoid pelvis, which allows the head to get through nicely, and then she has a big baby, we might have to cut an episiotomy. And we cut the episiotomy in the perineum. And sometimes we have to do straight down, which is you know, a surgical cut straight, or we go the medial lateral side. Okay, but that's what we're talking about when we're talking about episiotomies. And then of course, here's your vagina and urethra and labia majora, labia minor. Okay, and here's your mons pubis I talked about. Okay, just to freshen your memory. And then what I like about this one is that I always point out where the bladder is. Because when the bladder is inflamed, you can see how it gets inflamed. It would get kind of bigger, and then it would push right against this uterus. Say this is your uterus. And so this is what causes a lot of preterm labor, is urinary tract infections. And so it happens quite often. That's why we test every woman that comes in on every visit. She has to give us a urine specimen because we're looking for WBCs and nitrites in the urine. There's one thing I don't want my pregnant woman to go into preterm labor. We try everything we can, but when a patient gets to be more than 2 centimeters dilated, it's very hard to stop. So remember, nurses, we're in the business of prevention. And so we want to prevent any preterm labor. Okay, and then here, it kind of gives you a good picture of here's the rectum. And then you have here, you see here, here's the cervix. And that's where we feel there's 2 osses. You have an internal os, which is a little bit higher up, and then you have an external os. And when we get into labor, we'll be talking about that. But just to see the cervix, that's what we feel when we do like a sterile vaginal exam. We use 2 fingers only to go up and to touch the cervix and to see how dilated the woman is. And then here, of course, here's your ovary, and then here's your fallopian tube. So you can see how that ovary works, and then you can see how it releases that mature follicle and becomes oocyte, and then it's fertilized. There's fertilization that occurs right there, and then it travels, changing, cell dividing all the way into the uterus. Okay. So I think we got that one down packed. So if you have those questions, either on a quiz or an exam, you shall get them right. Okay, now you know the uterus is like a superpower organ. Did you know? Did you realize that? It's a superpower. Okay. And the reason is there's no other organ in anybody. Okay. Woman, male, men don't have that superpower organ. Women, we have a superpower organ, and that's the uterus, because it can expand. You know why it can expand without breaking? Is because it's made of 3 different muscle fibers. And that allows, so your muscle fibers are, look at my hands, they're interwoven like this, okay? And so when things are interwoven and they stretch out, they can stretch. They don't tear, okay? It's able to accommodate the growing fetus. So again, the organ, that's a superpower organ. And it does, it receives the embryo, receives the blastocyst, it burrows down into it, and then it grows the embryo, and then the embryonic stage, write this down, if you didn't write it down before, is week 2 through week 8. That's the embryonic. That's when he's a little tiny little thing. And then after about week 9, now becomes a fetus and is into fetal development. And then from week 9, I write this down, you should probably see it again. Week 9 through birth is your fetal development.
1 second. The embryonic stages, week 2
through week 8. Okay, and that's when all the beautiful cells are all formalizing, and that's why we wanted to take folic acid, is because during that embryo development time, okay, that's when everything is being developed, like open, like a neural tube, you know. So we want that to close during the embryonic stage. If it doesn't close, then you have a baby that will be born with spina bifida. And you have a baby born with hydrocephalus. These are open neural tube defects. And so that's why we encourage every woman to take in folic acid. During the ideal time is during the embryonic stage, which is week 2 to 3 through week 8. But do all women know that they're pregnant at week 3? Probably not. And so unless they're really trying. But usually the average woman doesn't realize she's pregnant until she misses that second period. Because the first period, she may say, oh, I was under a lot of stress. Oh, I missed my period, but oh yeah, I was too busy. So she might, kind of blow up that first miss of the period, and then she gets the next one and she goes, oh, I'm late again. Have you heard people talk like that? Oh, I'm late again. And then she goes to the clinic and she finds out that she has a pregnancy test and she's positive now. And she's pregnant. Okay, so, during that time, the average woman could be drinking, going out, young lady could be going out and still drinking, not realizing she's even pregnant. Okay, so that's why I've always tried to get women into the clinic pre-conception. We talk about that when I go and talk. I do various webinars and seminars and try to get women to come in before they get pregnant, is so I can get you on a good vitamin and some folic acid. Okay, so as I said, the uterus is a very, very strong organ. So this is a good picture of the reproductive system. And here you have the fundus, and that's the top portion of the uterus. Okay, and then you have the uterus, and here's your ovary with all the little follicles in there. And here's the little finger lines, the fembrae, and here's the fallopian tube. Okay, so it gives you another picture of what everything looks like. Now, the inside lining of the uterus is called the endometrium. And that's the inside. And that's really, by the time, when this occurs, when fertilization occurs, she's 2 weeks, obviously she ovulates a couple of weeks before she has her next period. And so during that time, that the blood in the uterus is increasing. Okay. And so it makes for a really rich I say soil-like. And so that when the blastocyst is looking for a place to implant, it's going to burrow down. It does. It kind of burrows down and implants itself in the uterus. Okay. So it's really a pretty phenomenal thing happening here. So you see the broad ligaments. So you see these ligaments? These ligaments, they don't change in size. So when this uterus does grow to house the growing fetus, this puts a lot of pressure on these ligaments on the woman. And what that does, you can see how that would shoot a pain right down her leg. It goes from her groin all the way down her leg. And that can happen. Okay. Hold on just a minute. My phone's going crazy. Let me make sure it's not a student. Hold on. Let me just check, make sure. Okay. Okay. Oh, okay. Yeah, okay. All right, we're good. Okay. So anyway, you can see how that ligament can get stretched. And what that does, it puts a lot of pressure and that goes right down her leg. And when we'll talk about pregnancy in the next couple of weeks now, when you hear me say about broad ligaments, you know what I'm talking about. Okay. All right. Let's go on. All right. So, don't forget we talked about the cervix already. And I talked about we have an internal opening, which is your internal os, and you have an external opening, which is going into the vagina. That's external os. Those are two osses. They do protect the growing fetus. And the mucus plug also protects the growing fetus. And so thank goodness that really stays in there long enough so that no bacteria can ascend up into that uterus. Because you don't want to get, the chorion and the amnion, which is surrounding the amniotic sac. You don't want to get that inflamed. No. Okay, so you got that. And then, of course, you have the mucosal lining. And so basically what that does, it lubricates the vagina, okay? And so a lot of times a lot of women will have some extra discharge, and that's okay, because that's what it's supposed to do. It's supposed to keep that vagina nice and lubricated. And again, it does keep out bacteria. We don't want her to get infected. All right. The fallopian tubes we talked about is the site of fertilization. I think we got that pretty well under control now. And then, of course, is the means of transporting the ovum, the zygote, to the uterus. So the fallopian tube is pretty good. Now, when you have such a condition, such as an ectopic pregnancy, right? So write that down, ectopic, ectopic. The ectopic is a fertilized ovum that has made its way up, but it gets stuck. There's a problem in the fallopian tube. It could be from it could have scar tissue. It could, women who have recurrent chlamydia infections, or other STIs, sexually transmitted infection, will have some scarring of this fallopian tube. And that's how come that oocyte or zygote can't get any further. And that becomes what we call ectopic pregnancy. It does need to come out. Okay, nothing else is gone. And so what happens is that this little thing here didn't know to stop cell dividing. It keeps dividing, and it becomes really big, guys. And when that little thing becomes big in that fallopian tube, it causes a lot of pain. And so this woman has a lot of pain. And if we don't get it in time, she can lose the entire tube because it ruptures. Yeah. That's what causes so much pain. So when a woman calls you, if you're doing triage in an OBGYN office, and a young lady calls you and tells you, I'm having such Oh, right pain. Oh, really low, nurse. Okay, bingo. And then I say to her, when was your last menstrual period? And usually they tell me, oh, it was like 8 weeks ago. I think, or maybe 6, or maybe, oh, yeah, around that time. Okay, I'm thinking right away, atopic. And I send her to the hospital to get an emergency ultrasound. And I call the hospital to let them know she's coming. So we want to get that as soon as we can. We don't want it to rupture. We want it to stay intact, and then we'll get her methotrexate, which is that's like cancer medication, which it targets right there to that atopic and breaks it up, and it's gone. The body absorbs it. So that's pretty interesting. So that's an atopic. So when we get to be talking about atopic, should be really good about it. Okay. And so the fallopian tube does have 4 sections to it. And the one where fertilization occurs is the ampulla. There it is, AMPULLA, ampulla. Okay, all righty. Pelvises, we talked about the different pelvises. There's got like the gynecoid is most favorable, the planetoid is not. And so it's a passageway for the baby to come down. So you want a nice size pelvis in order to accommodate the baby. Okay, and of course you know that the uterus until week 10 lays down low in the pelvis. Okay, and then about week 10 it now comes out of the pelvis and becomes what we call a temporary abdominal organ. Okay, so now it's in her abdomen. So it grows. By week 10, it comes out of the lower pelvis, and now she's an abdominal organ. And that gives a lot of room for the baby to grow, let the uterus grow. Okay. And here we go. Here's the different types of pelvises. So you can see the gynecoid and the android, the androthoid and the planetoid. Okay, but gynecoid is your most favorable. Planetoid is not. All right. So if I was to ask you a little brain teaser, the nurse is teaching a health class about the 4 different types of female pelvises. Which pelvis is optimal for passage of the fetal head?
A.
You got it. Good job. Good job. Okay. So I think we did pretty good on that. So that was chapter 2. So now we're going to go into chapter 3. And remember, I was talking about cell division occurring, and so we have, you have your DNA, you have your chromosomes. So I would know there's 46 chromosomes, right? 23 from sperm, 23 from the ovum, the egg, and then there's only 1 sex chromosome, right? And we know that different things can affect this growing embryo, such as teratogens. And teratogens are things that can harm a growing embryo and fetus. Okay. Okay. And I just love the DNA. I love this helix. Just such a neat picture. Okay. Go on. So again, we have mitosis, which is your division and multiplication of body cells. Body cells. Okay. And then you have meiosis, which is the process taking place in the sex cells. So they have a lot of, cell division going on. Okay. So you just have to know basically, being able to recognize the mitosis is the division and multiplication of body cells. Okay. The body will grow. The body will develop. Yeah. Hello.
Hey, Mr. Durham, this Kayla. Hey, can you go back to the last slide? Because I was trying to write it and you kind of went a little fast for me.
What, this one? This one?
Yeah. Yes, ma'am.
Yeah. And plus you all have
one more time.
Plus, you all have that. Okay. Well, you know what? We have. Okay. Well, I guess let me go back to this slide then. Let's go back here. All right. So we have how many chromosomes do we all have?
46.
46, right. 23 from the sperm and 23 from the mom, right? Okay. Then we got one sex chromosome. Okay, good. So when the ovum and the sperm connect and fertilization occurs, we're going to grow, and we're going to by two processes. One is called mitosis, and the other one is meiosis. That is the cell division. And so they're going to grow. So they have these little cells have to divide and conquer. They have to divide and make more. They did go from a 2-cell to a 4-cell to a 6-cell to an 8-cell, and then they become a morella. So the term for cell division is called mitosis, and that's how the everything becomes around. We start with a little cell.
And that's when the body's growing, correct?
Yeah.
Okay.
So we gotta, so this little cell, really tiny cell, okay, gets through the fallopian tube, right? Is now growing. And how it grows, it grows and divides. So now instead of 1, I have 2. And then I do some more. I go from 2, I go to 4. And I go from 4, I go to 6. And from 6, I go to 8. And I keep dividing and multiplying and dividing. And actually, when those cells divide, they're actually the term is called cleavage, just like a woman's cleavage.
Cleavage. Okay.
All right, that's called cleavage. All right. So I think we got that. So you got that? Okay, good. All right. And then we have the other process is called meiosis. That's the process when taking place in the sex cells. So again, everything has to multiply and divide, Okay, good. All right. So yeah, you got it. You guys got it. Okay, and then we're all made of genes. You know, you got your mom's gene and you got your dad's gene. Remember, remember how we had kids and the child would be bad? We say, oh, you got the more genes from your dad. Right? Because we inherit things. And we get into this when we get to talk about, certain diseases in newborns, is things that can be inherited. The dominant trait is the dominant. That's very overpowering when you have a dominant trait. So you may have a condition that's passed on from mom to the baby, right? And so she has a dominant trait, say for sickle cell. And so she passes that on. And so those how everything comes around by genes. Every gene has a code. It's amazing. It has a code for inheritance. As if you're going to have, say, dark hair, or you're going to have light hair, blonde hair. If you're going to have green eyes, or you're going to have blue eyes. Those are all things that we inherited from our parents. Okay. All righty. So we talked about fertilization quite a bit. So I think we're pretty good. Anybody not good on fertilization, where it occurs, how it happens? Only 1 sperm is necessary. And that sperm is really cool. He gets in. He's got to there's trillions of these guys, but he's got to be a good swimmer, okay? Because here's this little egg, and she's right there in the fallopian tube, and she's going, ha, 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 ha. And all these trillion of sperms are coming up, right? And so only one, as I said, the fastest swimmer, can get there. And he gets inside that egg. And then what happens? She gets so smart. She says, that's all I want, just one. And she puts this R around her, okay? And she goes, no more can get in. The store is closed. So remember that, just one. All right. Okay. She's a smart little thing. All right, so here we go. So again, this is a great picture. I just love pictures. I don't know about you, but I love pictures. And so here we go. Here's your immature, here's your follicles. Here's your mature one. Here he releases that. Time to go. The fembrace. Look at these. These are looking like little fingers. And that grabs it. And that's the fimbriae. And then it becomes the oocyte. And here you go. Okay, you see how the cell, here's your zygote, and then here by cell division, it starts to divide, see? And then it multiplies, and then it divides. And then it keeps multiplying. And then you got your morella that's usually right around in here. Okay, probably this is my morella on this one. And then here's my blastocele. And so blastocyte. And then this one goes and burrows down in the uterus. Okay, I think we all got that. Anybody not have that? Another, this comes out of your book. This comes out of your book. All right, anybody? Okay. Now, again, the father's sperm is the one that determines the sex of the baby. Okay, so that's important to know. Are you there? Are you guys there? Did I lose you guys? Are you still there?
Yes.
Oh, okay. All right. You're all so quiet. Come on. Yeah, no. So I felt like I was alone in here. Okay. All right. So here you go. And then this is another, I shared this the other day. But the reason why I'm sharing this again is you need to see, and it's in your book, you need to see the layers of the uterine cavity. So the amnion is right here. This is like the inside lining. And then you've got your chorion. And so all these are protective layers to protect the growing embryo. This is an embryo. And here you have your yolk sac. And then as soon as the placenta takes over, is mature enough, the yolk sac will disintegrate. And then here is your placenta. Good to know that all these little spiral arteries in the placenta, because the placenta is laying right against mom's endometrium. And so you have to know that for later too. So I want you to make sure you understand how this works. So you got the maternal side of the placenta, which is called the Duncan, and that's laying up in her uterus, in the endometrium of the uterus, okay, which is the inner lining of the uterus. Okay, then here's your umbilical cord. All right, then here, guys, is the mucus plug. See here, now that keeps a lot of bacteria from getting up into the uterine cavity. All righty. We talked about this already, so the morella. And if nobody has any questions, I'll just keep going. Okay. We talked about this a lot, implantation. I think you really know it now. Okay. All right. I'm just going to scoot over. Now the chorion, remember that layer of the uterus, of the uterine cavity? All right. That takes in the embryo, the amnion, and the yolk sac. That's like the big old umbrella. All right. So it's a thick membrane, thank goodness, and it does extend into the endometrium or the decidua basalis. It does extend into that endometrium. Everything is well done, actually. Now, these are times, let me tell you, during the embryonic time is the time that things can happen. Okay, things can go very wrong during the embryonic time, like the neural tube doesn't close, or if mom's chromosomes, if mom's egg is too old. So say she's like 37 years old having her first baby, her egg is getting old. Okay, those chromosomes have to match up perfectly. Okay, so if you get like chromosomes all have what, 2, right? Okay, but if you get an extra chromosome, then maybe instead of looking like this, that other chromosome is going to attach to this other guy. That's a defect. That's called a trisomy. So that's a defect. And then the baby comes out with a problem, such as Down syndrome. So that's why anybody that's advanced maternal age, we really like to do an amniocentesis. Okay. Okay. All right. This is about the amnion, which is your second membrane, which you saw that in the picture, and I have it right here for you. Let me get rid of this so you can see it. And what I want you to make sure that you understand that it also protects the embryo. So both the chorion and the amnion protect this growing embryo, and it'll be a growing fetus. Okay, and then these chorion, these two, the chorion and the amnion, they form that amniotic sac. You can see that, can you not? You all see that? See here, here's the uterine cavity, and then this is the going to be the amniotic fluid. And so it really does form an amniotic sac. Now that amniotic sac is going to have fluid. Okay. Now, baby needs to have fluid, all right, in the sac in order to grow properly, and it acts like a cushion. So what I want you to take from this also is just write down that amniotic fluid is clear, has a mild odor, and may contain bits of vernix. Remember vernix caseosa? What's vernix caseosa?
Isn't that the white like covering when the baby is born?
Yes, it's the white, it's like nature's cold cream. I remember that. You know, it's so thick. But what's the purpose of vernix? What do you think? If this baby's covered with all this beautiful cream, heavy cream on it.
Is it to protect the baby?
Yeah, protect the skin. Because don't you remember, like if you go in a pool and you're in that pool for 8 hours, what do you come out looking like? Well, I know what I come out looking
All
like.
pruny and wrinkled.
I look like a raisin. Ah, okay. All right. So you don't want that. So you have the baby is in this amniotic fluid now for how many months? A long time, 9 months. So he's got to have protection for his skin, and that's the vernix caseosa. It does a really good job.
Is
Another
that they said they don't take that off the baby no more after
No,
delivery. They
not
used to
really.
wash it off, but now they don't.
No, because it has such good purposes. And what we do is, you know, when you have a preemie baby, you're probably going to take off more because you got tubes, everything for preemies, and they have a lot of vernix caseosa born on them because they're preemie. You know, they're born too early, so they haven't used all their cold cream up. Now, when you get to term, the term babies have cream like this vernix caseosa in like their armpits, here, and maybe behind their ears and in the groin, and that's okay. We leave that on and we just wash around it. But post-term babies have very little left because they used it all up because they're post-term. They got overcooked, put it that way. So they have less. And so yeah. Now langugo is tiny hairs. Now these are terms, just write them down because you're going to need them, okay, in the future, in the next couple of weeks. Langugo is those tiny hairs that are on a baby. Now, when you have a premature baby, okay, a baby that's born before 37 weeks gestation, he's going to have more of that on him, okay, when he's born. If he's born at 26 weeks, he's got a lot more little hairs all over his body because they're there to protect him. You have a term baby. Baby is born at 37 weeks or to 40 weeks and 6/7. You have a term baby. They have little because they've already shed it off, and now it's floating in the amniotic fluid because they don't need it anymore because they're ready to be born. Okay, they're term. Now, post-term baby, what do you think they have?
None.
Less or none.
Right. They have very little because they're post-term. Okay, exactly. So now you can kind of understand that that's good. All right. So this is a very important slide. This is the functions of amniotic fluid. So write this down, take a picture of it because you're going to need it. It maintains an even temperature in that sac. Okay. All right. The amniotic fluid also protects the fetal skin from sticking to the sac. Okay. If you didn't have that fluid, he probably would stick right to the sac. He wouldn't be able to grow. So you want to have enough in there to protect his skin. Now, symmetrical growth of the fetus is so important. So say my right hand is here, right? And my left hand. So in utero, this amniotic fluid allows these to grow symmetrically. That means even, all right? If you didn't have that fluid, it might not grow that way. It might grow that this hand is bigger than this hand is smaller. See? So that's why the fluid allows that to happen. Then another very important one is that it allows buoyancy or for fetal movement. You know, mom feels that baby move, and then it's because it is floating in this amniotic fluid and allows him to do that. If he didn't have amniotic fluid, he couldn't do that kind of movement. Okay. And the last is acts as a cushion to protect the fetus and the umbilical cord from injury. We want to protect the fetus. Okay. Mom's walking around, you know, and if mom falls, that amniotic sac, that fluid will protect that fetus. Okay. So we want to make sure that we keep the baby growing properly and that we protect the baby. So those are the functions of amniotic fluid.
Is that the fluid that comes out when the water breaks?
Yes, that's what the amniotic fluid is like when it's her bag of water. That is another term that you probably a lot about, is a bag of water. And so when she goes into labor, a lot of times the bag of water will break. It'll trickle. Some have trickles and some have gushes, but it has a trickle of fluid come down and it's continuous. And a lot of ladies say, oh, I think I peed on myself. Then all of a sudden she stands up and more is coming down the leg. That's her amniotic fluid. Yeah. All right. The yolk sac was on that one of the pictures I showed you, and it had looked like a yolk. That functions only during the embryonic life. Okay. Everything has a purpose. In the embryonic stage, like the yolk sac has a purpose to give nutrients to this growing little embryo that's in there. So basically, it also produces the red blood cells. Okay. And then it does continue until the fetal liver takes over about 6 weeks. Okay. So again, that's during the embryonic stage, because embryonic stage, remember, is week 2 through week 8. Okay. All right. And then when it's done its job, okay, the umbilical cord now is formed. That will encompass that yolk sac, and then the yolk sac it gets used up by the body, degenerates. So again, it's pretty dynamic. Now that little zygote that we've been talking about, that been traveling its way through, has 3 different primary germ layers. This is what it's made of. So you have the ectoderm, and you have the mesoderm, and you have the endoderm. Well, part of the mesoderm is your true skin, the skeleton of that little embryo, the bone and cartilage of that little embryo. That's called the mesoderm. It has your muscles, formalization, everything formulating. See, this is the embryonic stage. Everything is coming together, and these are doing a lot of hard work. Then you have the endoderm, which is, think of your trachea and your pharynx and your bronchi. Endo, inside, lining of your digestive tract. Endo, lining of the bladder and the urethra. Okay, it's the inside. All that's being developed. And then you have your ectoderm, which is your outer layer of the skin. You have your oil glands, you have hair, hair had the follicles on the skin, you have nails, external sense organs. All those things are being formalized. That's why I said the embryonic stage is a very, very important time. So these are things we've just been talking about. We talked about the zygote. It's a cell that's formed by coming together, the union of the sperm and the ovum. The embryo, that little guy, little peanut, he is from the 2nd to 8th week of development. And then you have the fetus from week 9 until birth. Okay. And then we have a term here, it's called viability. And what viability actually means is the ability of the baby to live outside of mom's womb. He's able to adapt to what we call extrauterine life. And so that means outside of mom. Okay, he's able to survive. Now, a 20-weeker will need a lot of care. They go straight to the NICU, and the NICU is the neonatal intensive care unit. And they will be working on that 20-weeker, believe me, because 20 weeks, his lungs are not even developed enough to be actually breathing on his own. But we can save these babies, and we have saved these babies. They come out and they're like 1-pound babies. And the NICU does remarkable work. Okay. And so that's the age of viability. Now here, it's just another drawing of from the zygote to the embryo. So I think we got this pretty good. Here's your zygote, and here you can see the cell division, more cell division, turns into what we call morella, and then the blastocysts. And you can see how everything is starting already and having grows. And here's another little drawing of our little embryo. Okay, you can see the neural tube, the neural groove right going down here. You can see the surface of the amnion we talked about, the neural grooves. Yeah, all these little things. How interesting we all started in life. Okay, and a little visualization of fetuses, because now it's 9 weeks. So at 9 weeks, we turn into a fetus. And now during this time, from 9 weeks all the way to 40 weeks gestation, we are going to be developing now into what we recognize more of a baby. Okay, because all the organs, everything is started. Okay, it all started back here. Okay, all got to start. But now it's the fetus time to actually grow. All these organs got to grow. Okay, so now 12 weeks, your sex organs are going to start to get differentiate. 16 weeks, you got your fingers and toes developing. At 20 weeks, his hearing begins. Okay, 24 weeks, his lungs begin to develop. And see, that's why I said a 20-weeker would really need a lot more, because his lungs are not even developed yet. It's about 24 weeks, and it produces a substance called surfactant. And you might write that down. It's surfactant, surfactant. It's a protein that you need to take your breath in and let it go out. In and let it go out. And so a baby born prematurely, say at 28 weeks, say, would need a lot of help too, because he doesn't have a lot of surfactant in his lungs to let him breathe easier. Okay. All right. And then at 28 weeks, your brain grows very rapidly. And of course, the brain keeps growing to way over 40 weeks gestation. That's the latest research on the brain. And so we don't do medical inductions like we used to, like at 36, or well, not 36, 37, 38 weeks, because we know that the brain's still growing and developing better. About 32 weeks, you have your bones that fully developed. Okay, we deliver a lot of babies at 32 weeks. And then you have 36 weeks, the muscle is fully developed. And then, of course, 40 weeks is your what we call full-term baby. And so babies can survive very easily. Okay, so here it is. You have a 29-weeker, all scrunched up inside. And then you have your 36-weeker. Okay, now we're going to get into more of some accessory structures of pregnancy. So we have the placenta. Okay, and this is what a placenta looks like. Okay, so we have the neonate side, which doesn't that look shiny to you? So we call it the schiltz. But when I was in school, I was taught to call it the shiny schiltz because it was a good memory jogger that was the neonate side. Okay, because really pretty side of the placenta actually is the neonate. And then here's your cord, and how the umbilical cord is usually implanted right in the center of the placenta. I mean, yeah, right in the center of the placenta. Okay, and so this is called a shiny schiltz. Okay. The maternal side, which is the flip side of that, it's got these little lobes to them, and that is called the Duncan side. And how I remember it as another memory jogger is called the Dirty Duncan, DD, Dirty Duncan. Okay, because it looks really like lobes. Because I remember this placenta was attached to mom's endometrium of her uterus, and so that would have lobes on it, so that it could connect with her body, so that through the spiral arteries that blood and nutrients could get through and go to the placenta and go to baby. Okay. Now, so we did this in the umbilical cord, just for another memory jogger, you have Ava. This is how you remember it: artery, vein, artery. Okay. And remember, just put down fetal deoxygenated blood. That means the oxygen's not there. And the waste products. Okay, waste products. Baby, has waste. It goes back to mom through the umbilical arteries. Okay, through the umbilical arteries. And then fetal blood, it takes oxygen and nutrients and then goes to the fetus through the umbilical vein. So it's a little different when you look at it for than our circulation. Now, on the placenta, remember, it is an organ for fetal respiration, nutrition, and excretion. Okay, so it's vital. So you want to have a really good looking placenta so that babies can grow beautifully. Okay, because they need it. They need it for nutrition. They need it for getting rid of waste products. They need it for respiration, for breathing. They need that. Okay, so you want a really good looking placenta. Now, there's 4 different hormones associated with the placenta, and you remember progesterone. You got estrogen. You got HCG and HPL. Okay. All right. So there's a transfer. Remember the placenta at the top in that picture I showed you? Okay, so now you got things that got to get transferred from mom to fetus and from fetus to mom. They're connected, okay? And so you have fetal, what kind of blood? Deoxygenated blood.
Oxygenated.
Good. And waste products that lead the fetus through what? Good, to the umbilical arteries. When you say it, then you're owning it, and you'll be able to retain it that way. Okay, and so normally, guys, the fetal blood and maternal blood do not normally mix. Okay, they don't. We don't want them to mix. And so so another way to keep that is from having it go through the arteries back to mom. Okay, but oxygenated blood, okay, has oxygen and nutrient rich blood from mom, okay, now goes into those intervillized spaces. Remember those spiral arteries I told you to kind of take note to? That's how that oxygen and nutrients go through that from mom and goes into the arteries in the decidua, which is your endometrium. Okay, and then the fetus blood releases what? Like waste, carbon dioxide, and waste products. Okay, so it's a really neat system, actually. So here's another picture of our growing fetus, and it's a really nice picture. You can see the little toes and everything. Has the cord, has 2 arteries and 1 vein, and here's how they're connected, and then of course the placenta. So again, I think I kind of made another slide because I feel such an important thing to remember. So arteries, vein, arteries, which is AVA. So you have 2 arteries and 1 vein, okay? And the fetal blood takes oxygen and nutrients before returning to fetus through the umbilical vein, and fetal deoxygenated blood and waste products leave the fetus through the arteries. So when we talked about harmful like teratogens, like harmful substances, they can be transferred to the fetus. Sure. Everything goes is small molecules that go through the placenta to the fetus. So nicotine can go through the placenta to the fetus. Drugs, like mom takes any kind of cocaine and marijuana, goes right across the placenta, right into the fetus. Okay, fetus takes all that in. Alcohol, mom drinks a lot. She's an alcoholic. She keeps drinking alcohol during the pregnancy. That will cross the placenta and go right to the growing fetus. Then when the baby's born, the baby does have problems related to those harmful substances that mom took in. So you have to keep that in mind. And when you talk to women that are pregnant, you have to reiterate a lot. These are things that can happen. And so, you have to be on top of all that. Okay, so here's your progesterone. So what's its function during pregnancy? It maintains the uterine lining for the implantation of the zygote. Okay, remember that beautiful lining I talked about? Okay, well, that's because progesterone has now prepared that endometrium to receive it. That's what the function of a female is. So that every month, her body produces enough progesterone to make this inner lining getting ready for what? The zygote or the blastocyst coming in to implant itself. Progesterone also reduces uterine contractions. So it's a really good hormone to relax the uterus. And you want enough progesterone because you don't want the uterus to contract, because she then would have a spontaneous AB. And so we want to have enough progesterone. This is why women who have recurrent ABs, recurrent habitual abortion, is spontaneous, is because she doesn't have enough progesterone circulating in her body to maintain, one, for implementation, and number two, she doesn't have it to decrease those uterine contractions. Okay, and then of course, progesterone does repair the glands of the breast for lactation, for breastfeeding, and it does stimulate the testes to produce testosterone, which then aids in the male fetus. Okay, all right. Okay, all right, let's go on here. So here's your HCG, which is also, these are all good, test questions, by the way. HCG, human chorionic gonadotropin, is picked up as early as 7 to 9 days. Okay, and it's picked up in the urine. And if you need to, sometimes, you run these pregnancy tests, such as I have here, and you can get an equivocal answer. That means that it's neither, you can't tell if she's positive or negative. So that's when you go and do a blood test, because it's more, that blood test is more invasive than just getting a urine sample. But if a woman is trying to get pregnant, okay, and she's fertility patient, she's trying to get pregnant, you probably would do a serum test, because a serum HCG gives you both the quantity, which is how much HCG is being put out, plus that it gives a really good positive answer. So you got a qualitative and a quantitative result. Okay, so and then you have your, again, HCG is your hormone that's detected in early pregnancy. Okay, that's a really good test question. All right, then you have your HPL, which is your human placental lactogen hormone. And basically what it does, it causes decreased insulin sensitivity and utilization of glucose. Now, babies need glucose. Okay, so glucose makes the fetus what? What does glucose make the fetus do?
Grow.
It makes it grow, right? Yeah, it makes it grow. So we want that to happen. Okay. All right, so here I got another slide, which is kind of condensing really easily. Because this is where a lot of students lose a couple points is on this. So again, the umbilical cord. Remember, artery, vein, artery. It's your baby's lifeline between the mother and the fetus. Very important. You have 2 arteries, so there's 3 different vessels, right? Got 2 arteries and 1 vein. Total of 3. When babies are born, we actually look at the cord, that their stump, we cut the cord, right? And then we leave a little bit left over. And actually, we're looking at the cord, and we actually count the vessels that are in that cord. Because the babies can be born with a 2-vessel cord, but the best is 3 vessels. You got 2 arteries and 1 vein. So your arteries, what do they do? What do arteries do?
Arteries, they carry deoxygenated blood and waste.
So they can, okay, so arteries carry the blood away from the fetus, right?
From the fetus.
Right. And then the vein, what does the vein do?
Returns
carry-
the blood
Yeah.
to the fetus.
The oxygenated blood back to the fetus.
You got it.
Oxygenated blood.
Right. So what is Warden's jelly?
Covers and cushion the cord vessels.
Well, what it does, yeah, it covers and cushions the cord. It protects it. It's like a jelly, actually. And you'll see it right over the cord. Okay. And of course, the cord is laying in the amniotic fluid, right? So the cord needs protection because that's the lifeline to that fetus, correct? So we want to make sure that nothing happens to that cord. And then again, the umbilical cord usually protrudes near the center of the placenta. Okay. Now there are certain, sometimes you have a cord that decides not to doesn't really go in the center, it goes on the edge, but those are different types of problems. I'm not going to get into that today. So, okay, so here's a picture of a cord. Okay, so your cord, the normal length is like 55 centimeters or 22 inches long. Do you see how beautiful this cord is? It's beautiful. That's a beautiful, healthy cord. That was a healthy mom that had a nice, healthy baby, by the way. When you have a mom who smokes, this cord doesn't look like this. It's much thinner, okay? The diameter is so small. And so just think, with the diameter small, then that baby couldn't get as much oxygenated blood that it should have got, right? So babies are kind of deprived of what they should be getting because of the what mom has taken in. And therefore the placenta is smaller, the umbilical cord is smaller because mom's been taking in a lot of different substances that are harmful. It does affect everything. Okay, so that's just another
So
memory.
how long do they wait before they cut that cord?
Well, babies come out, okay. And as long as the baby's doing wonderful, good APGAR score, we wait so that we see, it's not very long at all. We can see the blood return back to the baby. So it's like we hold it up and it kind of drains back to the baby, and then we cut the cord.
Okay.
It's not very long because it happens very quickly, but we do.
Right.
Now the baby's in trouble. Yeah, baby's not breathing. Because remember, one thing I want you to remember is the biggest job that this baby has when it is born is to breathe. Okay? Because of this. Because of the way that their blood circulates in utero is the opposite of what we do. Okay? So we have 3 different shunts. All right. And so these are the shunts. So you have the foramen ovale, which is here. Hold on just a minute. Okay. Got the foramen ovale, which is an opening between the left and right atrium. Okay. That's your foramen ovale. Now, the atrium is the upper chamber of the heart. Okay. Then you have another shunt called a ductus arteriosus. So say it with me, ductus arteriosus. Okay?
Ductus arteriosus.
Good, good. And that's a fetal artery. That what that does, that connects the aorta and the main lung artery. Remember, babies don't start breathing in utero around 37 weeks gestation, okay? And that's when their lungs really now are starting to operate. And so the ductus allows blood to detour away from the lungs before birth. So that's your ductus arteriosus. And then you have another shunt. It's called a ductus venosus, V-E-N-O-S-U-S. So that's a shunt that allows the oxygenated blood in the umbilical vein to actually bypass the liver and is essential for normal fetal circulation. That's called your ductus, what? Your ductus what? Venosus.
Venosus.
Yes. See, if you say these things, they become part of you, don't they not? Yeah. So what I would do, if you have like question about this, do what I did right here. Okay. So here you have your shunts. Okay. So here, remember the foramen valley? This is the upper chambers in the atrium, right, of the heart. And then here you have your ductus arteriosus. So remember that connects the aorta, right? Yeah. See how that works? Okay. And then see here, your little liver is over here. Here's the placenta. Here's the umbilical vein. And then here's your last one, the ductus venosus, right? So you see, these are all different shunts that allow, like the ductus venosus allows the oxygenated blood in that umbilical vein to bypass the liver. Okay, so that's what this one. So you can see how this one bypasses the liver. Because, you know, here's your portal vein. And so in here you guys go. Here are your umbilical arteries. You have two arteries, remember? AVA. Okay. And you have one umbilical vein. And that vein is pretty big. Okay. And so here's your placenta. So here you're going to get from mom some oxygenated blood, right? It's going to go through where? Where's it go through?
The vein.
The vein. Good. It's the opposite of us. And then here you go. Here, let's follow it up. And here we go. And so we got all these different, see how all these different ways are going? And these shunts are very, it keeps things from going to where it doesn't need to go because it's not needed yet. And it goes to keep this heart and his what? His circulatory system going. So this is the difference in the circulatory system. Now, I think Ms. Patel, you had questions about this. Does this review help you?
Yeah, it did.
Okay, good. Yeah, and then that we call that is circulation before birth. Okay, this is what goes on in the inside. Okay, so again, blood enters the fetal body through the vein that we just said, and then half goes to the liver, right? And the remainder enters the inferior vena cava through the ductus. Through the ductus venosus, then it goes through the foramen valley. So that explains that drawing very well. Okay. And then, of course, you have blood that has containing the waste products for the baby. That's returned to the placenta through the arteries. All right. All right. So I think you got that. You feel good about it now?
Yes.
Good.
Yeah.
Yeah, good. It's something, isn't it something how that really works? You know, how circulation inside works, that, you know, the babies, you know, things like the liver and everything are stimulated there, but the liver, even when babies are born at term, the liver is still immature because everything inside is growing during the fetal development time. And by 40 weeks gestation is when the baby now can survive very well outside of mom. And the organs, just like the liver, has to get more mature. The biggest problem I told you about for babies is breathing on their own. Once that cord is clamped, they always say they're on their own. You ever hear anybody say that in the delivery room? If you've been in a delivery room, They'll say, when's quarter climb? Okay, baby, you're on your own. That's what most OBGYNs said for years. Okay, and I just put this in here. I thought this was a pretty good little photo of what happens and how the different, you can see the different arteries and the different veins. The vein here, and then you got your two arteries intertwining here. Okay, all right. Now let's talk about how about after we come out? We're born now, so things have to revert, guys, to regular circulation. Okay, so now these shunts are no longer necessary, so they're going to close. And they all close a little different. Okay, so like the foramen valley, the one between the right atrium and the left atrium, that closes within 2 hours after birth. Okay, and permanently by 3 months. But after birth, he's on his own. Boom. So that foramen valley closes. Now the ductus arteriosus, it closes within like 15 hours. Okay, but then again, permanently in about 3 weeks, is no longer necessary. And then the ductus venosus, it closes functionally when the cord is cut. Remember I told you? The cord is cut. We say the cord is cut, baby's on his own. And that's what we're talking about. These are different shunts that have to close because you don't need them anymore. But guess what? All these shunts, they don't go to waste. They all become ligaments. So nothing is, if you notice, nothing is spared and everything is used very well. Okay. All right. So when mom, remember now, one thing I remember at maternity, you got two patients, you got mom and you got this baby and you got the baby. Whatever mom takes in goes to baby. We want her to take in good substances, right? Green leafy vegetables. We want her to eat good protein, right? We want her to have a healthy diet because when a healthy intake during pregnancy does influence the development of the fetus. If mom's undernourished, it can result in what? Permanent changes in the fetal structure, like physiology and metabolism. If mom's undernourished, it can influence the development of conditions such as heart disease and stroke in adulthood. You didn't think so, but it does. If she's exposed to toxin in utero, it can impair prenatal development. And also, if she takes in harmful things, she can influence their health in later life. That is not good, okay? So you want moms to take in health, make healthy choices, put it that way. Now, there is a term, it's called intrauterine growth restricted. That's called IUGR babies. And these babies have a reduced number of cells on the organs. So what happens that these poor things, they're predisposed to development of diseases later in life. So we look at every baby when they're born, and we can best assess, we use their weight, we use their length of gestation, how many weeks gestation they were when they were born. We can look at that placenta. Remember, I told you the placenta size and newborn head and abdominal circumference. They're all considered. And then fetal growth limited by nutrients and oxygen received from mom. You don't want that. You want mom to get best. And then a healthy mom can produce a healthy child who is less prone to illnesses. And there's another term also that you might hear, not only IUGR, but also failure to thrive. This is where it also comes in that mom did not take in healthy nutrients during the pregnancy. So you can have permanent changes in the fetal structure, the physiology, metabolism of this fetus, development of chronic conditions later in life. So in order to prevent illnesses of the next generation, this generation has to focus on their own health practices. Okay, so coming toward the end, I'm going to talk about twins, like multi-fetal pregnancies. Okay, so we see more of twins than we ever have, and we see more, triplets, quads, is because of the infertility drugs that are being used also. But getting back to just basic, because when hormones are used to assist with ovulation, okay, you can have twins and other multi-fetal pregnancies. That's what I just said. So All I want you to remember is the mono means what? One, right? Monozygotic. So remember the zygote? Okay, you know that. So monozygotic are twins that form what?
And one stack.
A single fertilized ovum. Okay, there's only one fertilized ovum, and then they break off. Okay, so those are called identical twins. Ever see identical twins? I remember teaching on campus, and I had one of my classes, and I had two men in my class, and they were identical twins. I have never seen. They were like a clone of each other. They were so identical. So I had to like put one on one side and one on the other side. I had to make a drawing to know which one was which. It was really unbelievable how they were so identical.
So I wanted to ask you something. How did were both of their learning, like, how did both of them do in the class? Like,
well,
did one do better than the other?
Yeah, one did better than the other. one was more he liked to go out and and date and do some stuff, and the other twin was the total opposite. He was really a book learner. He was into his book, into studying, and so that's how they broke up. He went on and the other one didn't.
Oh, shit.
And it was very interesting. And the other one, the book learner, was trying to get his brother to settle down and to start, looking at it. And he said, well, that'll be okay. I can do it. No, he didn't. But he's an RN today. So apparently he did settle down after a while. Now you dies, huh? Oh, you had to.
Oh, I said very decent. Yeah.
You had to. Now your dizotic twins. Okay, so di is 2, and here's your zygote. So that's all it is. So you have 2. Now these have 2 separate fertilized ovums. Doesn't happen very often, but when you use drugs, when you have hormones such as like Clomid that's used in infertility, they are designed to release more ovums, okay, more eggs, and so that the chances are that the sperms will get at least 1, but sometimes they get more than 1. They'll get like 2, and then if you have triples, they get 3, because again, these medications release more eggs out of there, and that's why people have that. Okay, so here it's just, this comes right out of your book. I thought it was kind of neat. So here's your identical twins. So again, there's just 1, and then here's your fraternal twins, and so you got the 2. Okay. All righty. So these are little brain teasers to think about, when you're studying. What hormone causes a positive pregnancy test? HCG. What's the name of the hormone essential?
Was that a picture? Excuse me. Was that a picture of the twins in the same
Yeah,
set?
that comes right out of your book. Yeah, you see.
A is the
2 sacks, amniotic cavity. Okay, I'm letting you know, guys. There's a bad rainstorm in my area, so if I lose you, I lose you. Okay. We're almost done. Okay. Now, let me see. Here's your 2 sacks. Here's your 2 placentas. See, and here's your amnion that we talked about, the chorion. And this one, you have what? Amniotic sacs, and then you have your amnion and 1 placenta.
okay. I had fraternal twins.
Oh, did you? Oh, congratulations. So that's hard. Those pregnancies are hard, they're not easy. Now, if I asked you what was the significance of the gynecoid pelvis, what would you say?
It's the most favorable.
Yeah,
The most ideal.
Most favorable for vaginal delivery.
For vaginal delivery.
Good. And then what is implantation? Ooh, my lights are blinking. What's implantation? You know that is where the blastocyst will burrow down into the upper portion of the uterus on the posterior wall. Okay. And then where does fertilization occur?
Fallopian
Fallopian
tube.
tube.
In the ampulla of the fallopian tube.
Is
Absolutely
the
wonderful.
implantation in the endometrial? Or that's
Implantation,
different?
it's in the upper portion of the posterior wall of the uterus, and it burrows down into the endometrium.
Oh, okay.
Yeah, that burrows down. That her endometrium gets beautiful. It gets really very, very thick with blood, and that's before she has her period. It's like 2 weeks. Ovulation happens about 2 weeks before you have your period. So that's a good time to get pregnant, because by the time that little zygote makes its way into the uterus, it's another week. So now it's really rich with blood. And so there's a plenty of blood supply for that little blastocyst to burrow down into her endometrium, which is her lining of the uterus. It makes really, really nice plant. So I have this little film. Let me show you this, and it just takes a few seconds, not long at all. And I think it'll bring everything to life for you. So let me see if I can get it started. Okay, hold on. No, not that one. Let's see. It should work. I'm just loving things that work. Well, anyway, let me see if I can get this started. It should work. Of course, it'll work for me when I get done. I'm sorry. It should work, but I'll send it to you. And what it goes over fertilization. Okay. All right. All right. So we come to the end of this. All right. Let me come back here. All righty. Anybody have any questions?
Are we still gonna do the Kahoot?
Yeah, let me see how I'm going to do that. Okay.
Okay.
Hold on. Let me see. What happened to my
Mhm.
here? Let me get rid of this slide. Okay. Well, I got to stop sharing. Hold on. All right. So let me try this. Okay. You ready? Okay. Don't forget, you go on to the, click on that link I gave you. And now I'm going to give you the game pin number. I'm going to put in the chat. So let me go here, everyone. Okay, so 097 48 105. Let's see how this works. Let's see something here. Here's here's the QRS. That's that code here. This is also for the Kahoot. Oh, sorry about that. Hold on. There. You're supposed to be able to click on that and bring it up also.
It keeps telling me that the Kahoot is not valid.
It's telling you that. How could it do that to me? Okay. Well, I'm
What about
learning.
anybody else? Is anybody else able to get on it?
Hold on. Okay.
I was able to do it earlier, but when I tried to go back on it, it was saying the same thing.
Yeah,
Did
me
you?
too.
But you accessed it before though.
Yeah, from the first. I think you could access it from the first email.
I was able to get on it.
So what I'll do,
Send me the link,
Password or
Tamika.
something.
it will do is I'll make sure I gave you the link again. And I thought maybe I had it on my screen, and then give you the code. Okay, so hold on just a moment. Let's just see something. No. Okay. Yeah, so I'll have to do that. I'll have to
If you scan the barcode with your phone, you could bring it up, because I was able to bring it up.
oh, there you go. See that barcode here. Okay.
Yes, me as well.
Yeah, there, right there. Now let me even try it.
How can I do that if I'm doing the Zoom on my phone? Is there any other way?
Oh,
Not
well,
like an iPad or something?
oh,
No, I have my laptop, but
Oh,
yeah, guys, I just did it. I'm on Kahoot right now.
can you
I-
just share it? I'll just watch it. I just, you know.
Oh, I got a whole bunch of people on here. Okay. So you can scan that. Really, I came up on my phone really easily. And it comes up duplicate of maternity nursing week 1, chapter 3. You got it. Okay. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 so far have gone on it. I love it. Okay, so you can get on with this code here. Okay, did everybody able to do that? Was everybody able to do that?
Yes.
Okay, I'm learning. So I hope you enjoy it. Tia, I'll send it to you. Don't worry. I put the link already in I sent you an email, but I'll resend it if you want me to.
Okay, thank you.
You're welcome. Did you like the questions? Yeah.
Yes,
now
they
you-
were really good.
Yeah. So that's what I'm gonna do probably once a week is I'll have a Kahoot for you on the chapter.
That's awesome.
Okay. Now what you gotta do now is you have to what? Get ready for chapter 4. Okay, I sent the PowerPoints out for chapter 4.
Okay.
So the
So
quiz will be
we-
on 2 and 3.
And 4. And 4.
Okay.
Okay. Remember, the purpose of the quiz is to see if you did your reading. Oh, here, let me stop recording.